My name is Dr. Andre Johnson. I am an associate professor of rhetoric and media studies in the Department of Communication and Film and the scholar in residence at the Benjamin L. Hooks Institute for Social Change right here at the University of Memphis. On behalf of our executive director, Daphne McFerrin, and our entire staff here at the Hooks Institute, we welcome you tonight to our newly created Focus on Memphis series. Now, while COVID has been getting much of our attention, tonight our focus was centered on the HIV epidemic right here in Memphis. Before I introduce the moderator, allow me to do just a couple of things. First, I want to shout out two people who are really making this Facebook Live event seem, well, seamless. First, Nathaniel Ball, Assistant Director of Media Initiatives and Program Support right here at the Hooks Institute. He's running the Zoom room for us tonight. And of course, Megan Cullen, our administrative assistant, who would handle the questions from the Facebook audience and from time to time, drop nuggets of information in the comment section. I want to thank them for their participation tonight, and without them, this just could not be done. And second, allow me to share just a little information about the Hooks Institute. Our mission of teaching, studying, and promoting civil rights and social change allows the Hooks Institute to address contemporary racial, social, economic, and other disparities through community engagement and faculty scholarship. The Hooks Institute's mission-based programs embody the highest ideas of service, activism, and commitment reflected by the life of our namesake, Benjamin L. Hooks. The Hooks Institute implements the mission through research, education, and direct intervention programs. And for 25 years, we have addressed disparities related to race, education, diversity, and inclusion, and economic mobility. We invite you first to go to our website and sign up for our updates. Stay abreast on what's happening here at Hooks. Then, for all of you watching right now on Facebook, we invite you to like our Facebook page. Go ahead. Go ahead, like it now. Go, yeah, got it? Great. Now, while you're at it, can you just go over and click that share button so that others in your timeline would know that we are live, and invite them to like us as well? You can follow us on Twitter at Hooks Institute. That's it, Hooks Institute. And please follow our YouTube page as well, our YouTube channel rather as well. Now, if you forget all of these handles, no worries. We will have them in the comment section for you on this Facebook Live event. Now, allow me to introduce the moderator for tonight's Facebook Live Focus on Memphis series, Combating the HIV Epidemic in Memphis. Dr. Shemeka Hamlin-Palmer is a clinical assistant professor in the Department of Healthcare Leadership and a Hooks Academic Research Fellow at the University of Memphis. Along with her teaching, she has dedicated the past 15 years to working, partnering, and collaborating with CBOs, healthcare organizations, and other academic institutions to reduce the impact of health disparities, including HIV/AIDS, substance abuse, mental health, cardiovascular disease, obesity, and cancer in minority populations throughout the United States. Dr. Palmer also has another distinction. She is the first Hooks Academic Research Fellow to moderate one of our Facebook Live events. Dr. Palmer, welcome. It is indeed a pleasure to have you and this wonderful panel here with us this evening. Thank you for coming.
Thank you, Dr. Johnson, for that introduction, and welcome to our Facebook Live event, Combating HIV in the African American Community. We have some wonderful panelists here and would like each of them to briefly introduce themselves.
Hello, I am Juanita Davis with the Jackson Medical Mall Foundation, and I'm the director of CARE4ME Services, where we provide an array of services to reach people in the community where they live, where they shop, wherever we can do to provide the services related to HIV prevention and other STDs. We're about the business of the community, and we promote a community wellness concept. Thank you.
Hello, everyone. My name is Eddie, and by the books, I wear many hats. I am the Shelby County End the HIV Epidemic Initiative Coordinator for the Tennessee Department of Health, but you'll also find me roaming around on TikTok, hosting events, as well as doing a lot of other community work within Memphis, Shelby County, as well as my hometown of West Memphis, Arkansas. And thank you, Dr. Palmer, for having me.
Good evening, everybody. My name is Cedric Sturdevant. I am the Executive Director of a new community-based organization in the Mississippi Delta. We're located in Greenville, Mississippi. My organization is Community Health-PIER, where we focus on helping people live with HIV, the LGBTQ community, as well as educating young people on farming and personal development, as well as business development. We are new, once again, in the Delta area that wasn't getting much service here, but we are here now to help our community out.
Good evening, everybody. My name is DeMarcus Jones. I'm currently the Protocol Outreach Assistant at St. Jude Children's Research Hospital, where I work on many grants for the prevention of HIV here in the city of Memphis, and as well as with youth and young adults. You can also see me in many other community platforms, but more specifically, the Headliners Memphis, where I co-chair that particular organization that goes back into the community and fight.
When I tell you we have the best of the best here speaking to you and giving you information on HIV prevention here tonight. So if you have any questions, please type it and we'll do our best to answer it during the event. So ways to reduce the risk of contracting HIV and or STDs, STIs in the African American community.
Well, I've been in this fight for a very long time, since 1986, 35 years. And I've seen it all, done so many things, but understanding the community is key. Understanding the messages that go out to the community, understanding the messenger needs to fit the message that is being provided. And we make sure that we are providing information in a way that the community understands it. Holistically, we also need to make sure that we talk about abstinence, condom uses, not one time, but each and every time a sexual encounter takes place, using condoms and making sure we have access to receive services related to STDs and HIV prevention, education, testing, and treatment. All of those things are important, and how we get that to the community and get them to understand. And that one big word that we're going to talk about maybe later, stigma, reducing the stigma in our communities as we provide the services the best way possible.
I would have to go back to a little bit to old school and say education, especially in the area that I'm in the Mississippi Delta. You know, the lack of education around HIV, the lack of sexual education as well. The fact that we can't get into the schools to talk about sexual health is a big problem as well. And as Ms. Davis just said, you know, stigma. Stigma is in a sense to me taken over, especially in an area like this. We have to actually communicate to all people in the community, not just certain populations, but we have to communicate with all people and educate all people in the community around HIV in order to decrease for people from contracting HIV and live happy lives.
So I think it's really important. For many years, we've talked about meeting people where they are, right? And so for me, there's a new definition of what we have to take into account of meeting people where they are. So what we know is there are plenty of folks who are just going to do what they want to do, because I know for me, I do what I want to do. And at the end of the day, I don't want to be judged for it. So I think what that comes into play is asking people what it is that they need out of the services that we offer, instead of, for many years, us just telling them what we're going to provide to them. And that comes into play when we're using people first language, when we're talking about sex positivity, when we're discussing, just like everyone said, prevention, care, and thinking about the whole person, just like Ms. Davis said, because there's so many other elements of our lives outside of our HIV status, outside of the services that are rendered to us, to where we have to also think about our socioeconomic status. We have to think about our education, our level of community that we find within the areas that we're in. So if we don't reach those people, then we have a hard time providing the education, getting the testing, getting all of the services to prevent new transmissions.
It kind of took a couple of the words right out of my mouth. But I definitely want to say creating spaces where we can have just access to those individuals, and as well as just more so creating sex positive spaces. I know that we sometimes can be in situations where we don't necessarily feel comfortable being able to talk about all the things that we need or maybe have access to. But if we create those spaces where people can feel comfortable, you know, just speaking up for what they need, what they participate in, even what you participate in sometimes or whatever, I think definitely helps us get a little bit closer to knocking down some of those things that become barriers.
Okay. I know in the past when I've hosted testing events, it's hard sometimes to get people to come in and get tested. So how can we increase HIV testing strategies? What ways you think we can get, you know, more people to come in to be tested?
We have here at CARE4ME Services, and we also have a spot in Belzoni in the Delta. So what we try to do is, someone said, I don't know which, to meet people where they are. First, making an understanding what is going on in the community. And again, that ugly word comes up, stigma. And sometimes we use that word freely, but we truly don't know what that word means to people. But oftentimes there could be the very small stigmatizing that goes along with it. But understanding the community and helping them to understand what HIV really is, talking about it, giving information. We have a program called Speak Your Truth, where we go out and we talk about the truth. In order for you to understand what's going on, you got to understand the truth. And sometimes you may have to hear the truth from someone else because you're afraid to voice that truth. So hearing that and encouraging testing and to make it a normal test, not something out of the way, but just making sure that everybody understands this is something that we all need to know our status. And sometimes we focus on putting or labeling it on another population, but it's all about us. And we have to make sure that we focus and sell it that way, promote testing as a one for all, not just for some populations, but for everyone. So we'll become a regular routine test. So as we go into community, it would encourage people to not be afraid to come to the mobile to get tested or to go and seek testing or any other thing related to HIV.
I think you hit it on. So speaking of exactly what it is, we have to speak up to the funders who are actually providing the money to the community, because at that point, a lot of the years we had a specific population that was prioritized. And so I'll just say, from the Black gay community, I was tired of seeing a mobile unit outside of the club. Like, I come to the club to come to the club, but in our regular everyday lives, by having those services available, giving us options. You have a mobile unit here, you have a safe space over here, you have a pop-up over there. And also say we're going to dive outside of just this one particular population, because just as everyone will say, the HIV has no specific face, it has no specific population. And I think it is a disservice to the community when we don't particularly ask them, what does it HIV test look like? Would you like a home test kit? Would you like someone to come test you? So if we have more options, we'll be able to, specifically with the Black community, because we're always trying to get the African Americans out to get testing. And it's something that we do incentivize. I don't believe that we should have to incentivize it, but if you want a gift card, come get the gift card, because we want you to live your best healthy life, whether it comes in your sex life or if you're living with HIV, your partner's life, all of it comes into play. So yes, we definitely need to speak to the funders as well as to our higher ups, because those are the people who make the decisions.
And what we've learned to do with the funders, understanding we reach that certain population that's targeted, but also we don't refuse services to anyone. We try to do it in a fashion that is available to everyone. We sell it that way, even though we may be focused on one particular community. We want it to be for everyone. Everybody needs to know their status, not just the gay people, not just the LGBT, you, everybody. So when we get that in our system, that it's about everyone, we can do so much better in making this epidemic end like it should be. But we got to stay focused and make sure that we sell it in a point that it's about everyone has sex is at risk for HIV, not the type of sex you have, but everyone. I'm sorry, okay.
One of the things that we do here is we definitely collaborate with other organizations. Even organizations that may not be so HIV centered, but sexual health centered. We also, because the Delta is kind of spread it out and we don't have a mobile unit yet. We collaborate with the mobile unit in the Delta area called Plan A, to whereas we go out with them and they allow us to test on their mobile unit because they provide other services as well. And to help get out into the community throughout the Delta. So definitely organizations collaborating together to get testing done, to educate people about the importance of being tested. I know, with me being a new organization in this area, that I can't do it by myself. And I'm not going to try to just say, hey, I'm going to change things. No, I need other people around me that's focusing on the same thing that I'm focusing on it, and as an organization, and our goals are the same, to help people, educate people, and as Eddie just said, help them to live their best life.
I would definitely say fundamentally, those collaborations is really what helped me just really get into the footwork of what, making sure that everybody get those testing and things of that nature. So that collaborative work definitely is something that I'm very on board with, and definitely thinking of those unconventional ways of how you can get into communities, whether it's through events, whether it's through your messaging, whether it's through some of your advertisement, but just think a little bit outside of the box, and make it, and just going back to Miss Juanita's, just making sure about Juanita's point that testing and knowledge and everything is for everybody. So there's no one right way or another. Just make it, unconventional, and just think outside of the box is what I add.
One thing I can't, so over the time, we've seen so many success stories of testers collaborating with churches, beauty shops, barber shops, and think about these collaborations, even whether if there are HIV service organization or not, we definitely need to be able to tap into those places. Because I know the beauty salon was a safe space for me, even though I wouldn't get my hair done by my mom. But there people go, these are places where people talk about sex. They talk about these things. And so if we're working with that, and also to Cedric's point, we have to work with our bigger organizations to say, how do we work or collaborate with the small organizations that actually have the footprint with the community and actually doing the work? Not saying that the big organizations aren't, but we have to be able to build each other up. So that way it's not a competition. It's definitely a collaboration. It's definitely a partnership. And that's what it will take to end the HIV epidemic.
I know one way that I had increased testing efforts was to collaborate with health fairs so that it wouldn't be just HIV testing only, because people wouldn't just come in because it was such stigma on just coming in for HIV testing. So if you are offering hypertension, diabetes, other testing, then people were more likely to come in to get an HIV test in addition to other testing that they were already offering. So I saw that my testing increased that way. So when you collaborate with other testing events, then I saw that my numbers would increase. So that's another way to increase your testing strategies also.
And so we do a thing called one stick, the results, because we don't want our mobile unit to become stigmatized that it's just an HIV facility or where you can go get tested. We want to make sure that people understand it. We promote community wellness. That is our point. We want to educate everybody, whatever the problem may be that they come on. So if they have to do a finger stick for glucose, then when they get off, that's their business. When that finger goes out, it doesn't say which test they got. They just go out. And that way it relieves some of the stigma that other people can say she went on there, she got the test because she did something, or he went. So just understanding that is a very good thing, and just to collaborate with as many people as you can to make sure things happen. We try to work with COVID. I had a bus to go with us to do the COVID testing. So we were working in sync with each other to help all people get what they need.
Now, the big question: stigma, HIV stigma and discrimination in the African American community. So that is the big talk. That is something that keeps a lot of our people who's HIV positive from coming in and seeking help, seeking health care after they have received their positive result. I've seen this so many times. Our retention rate is so low simply because of stigma. Even with healthcare practitioners, I've seen this, So how can what strategies? I know healthcare practitioners really need education when it comes to providing care for HIV positive patients. And when it comes to HIV stigma and discrimination, this is a topic that we, may not want to talk on a long period of time, but I've seen this myself. So how do you want to discuss this?
Okay.
I have
this is the hard topic.
It ain't hard for me. I mean, I may get in trouble what I say. So
we like trouble. We like trouble.
Good trouble. Let me put it that way. But stigma, and I think sometimes we ourselves don't understand how we give off stigma as well. What we do and how we do what we do. And so we have to all understand that whether it's stigma across the board, whether it's self-induced stigma, and I see so much self-induced stigma when we degrade each other and talk down about one another and go here and talk, it's making all of us not be accepted. So as we learn to support each other in our efforts, and to help people to understand that we're all in this together. It's no one else. If it happens to me, it can happen to you. Don't get bogged down and try to pull someone else down because something is negative going on with them. But I try to work from a strength-based approach. Always, if I see you looking down, instead of saying what's wrong, what's right? Because you're going to get a different response. Let's help people to understand that we're all in this together. And I'm no better than you. You know better than me. We're all in this together. We need to fix it together. Stigma, we need to talk about HIV as much as we possibly can. We need to talk about sexual health. What's good for me? What's good for you? Everybody's different. But at the same time, when we get down to it, sex is sex, right? And so we need to be able to discuss it openly and try to reduce the self-induced stigma. Because in Mississippi, we are playing with so many other health disparities and so much other stigma. But why do we have to be bogged down with this stigma on our back when we can work together and get through this thing? And that's what I have to say about it. We need to come together, you, me, him, her, all of us. We in this together. I ain't no different from nobody else. And I hate for somebody to tell me you a cisgender woman. I don't care if I'm a cisgender woman or not. I can do what I can to help you. I can stand in your shoes for a minute. I may not fit them all the way, but I can help you, help me. So we can all do this to work together to make our community safe. Period.
So I am definitely on track with that because stigma is a killer. And for many years, I've said that stigma is literally the biggest killer of people living with HIV because it is about the stigma that goes on. So when we are in our communities, I take a note from the younger generation. So they've been calling out their parents. They'll say, oh, no, you can't say that. We have to be able to do that in our community. So when I used to hear people, even before I was living with HIV, when I used to hear people say, oh, they're clean or they're dirty or whatever, I would call it out and just say, look, what do you mean? Did they not take a bath? Did you? And so it's really tearing down the language that we hear. We have to do it in the moment and giving it in a teaching moment, bashing over the head, more so being able to provide the resources. So it's on us as HIV service providers to be able to communicate this better, whether it's through a virtual platform like social media, hosting seminars like this, or having resources printed out. Most people don't like printed out resources. I like social media. But in essence, we have to be able to quickly be able to send it to our cousins, send it to our aunties, send it to our mamas, because these are the people in our lives that are leading the charge. And so even when I used to work with a lot of the first ladies, I would hear them try, you don't get no A for effort with me. So you're either gonna give it your whole butt or you're not gonna give it at all. So it's more so of like, look, now let's have the conversation of what it is and what it is not, and how these things can actually harm more than they hurt. And so when we think about it, we have to get rid of our biases. We have to get rid of all of our judging, like all of our places of no matter our profession. We all come with our own biases. But when it comes down to serving the community, we have to be able to say, what is it that you believe and how can I get rid of that? And as a community member, I have to be able to say, I learned this information. How can I disseminate it to someone else? So that way, my friend won't have to pass away, or my friend won't have to not go to the doctor. So decreasing stigma is going to come in campaigns. It's going to come in PSAs. It's going to be able to have folks say those 3 letters that they're very afraid to say HIV, and not whisper it at a restaurant to say, oh, I want HIV, or, these things definitely have to be lived out loud. And so that's part of what's going to help decrease the stigma, making it comfortable for folks, paying folks too when they tell their story.
And I say that because I was the director at an HIV LGBT clinic, and I had that population talking to me about the stigma and the racism and all that came with them not being able to access services. That's the reason a lot of them wasn't going in to receive the health care that they needed, because each time that they was going in, they felt judged. So that's the reason why a lot of them wasn't going into regular clinics to get services, to get their meds. So they felt, they felt that the minute they walked in, they were being judged. The transgender population, the minute they walked in, oh, people were talking about them. Oh, they were getting looks. So they chose not to return. So until we can get, and then if they went into talk to the healthcare provider were giving them certain looks or act as if they didn't want to touch them, provide the services to them. So they were like, they didn't want to return. So if you're receiving that type of quality of care, would you want to return? Would you want to see that physician? That's the reason I say, you have healthcare practitioners that, have that stigma, that discrimination against certain populations. So until we can provide that education, get practitioners on board that comfortable with providing those services, then it's still, we having an issue with providing HIV care, HIV services to the population.
I think that's also, can I say one last thing? You spoke a word on that, because we don't think about our sex workers, our people who use drugs, and we do discriminate against those populations as well. And what we know is that there is a larger number of African Americans coming into that population of people who are using drugs. And so they are mostly left out of these conversations, and they are very behaviorally vulnerable to HIV. So at that point, we have to be able to normalize the conversation and not necessarily say, oh, you gotta jump straight to rehab, but being more patient and having grace to say, let's give you the better practices of staying healthy. And then we can have the conversation of whatever it is that you want to do. But my goal is to not give you my goal is to help you get to the place where you feel you're at your most healthy.
I think another area that we need to hit is the faith-based community. In order to eliminate some of the stigma, we have to get into the faith-based community. A church doesn't know who they have in their congregation. And the pastor may say something bad, or someone in the church may say something bad about HIV, and that'll affect that person. That will kind of shelter that person in the sense that where they may not want to go to a doctor appointment because somebody in that provider's office may go to their church, and they don't want to know, they don't want people to know all that. And I think the faith-based community can help a lot on eliminating some of the stigma, and especially the preachers behind the pulpit, and just talking about love in general, regardless of a person being of the LGBTQ community plus, or being living with HIV, and to educate people on the laws around HIV. So the discrimination on the laws area, people thinking, oh, you told me I had HIV, I have sex with you, but I'm mad at you now, so I'm gonna go report you that you didn't tell me. So we need to educate all of that and just it'll help eliminate some of the stigma.
Okay. It is my dream that HIV is removed from the LGBTQ community. If we can take that away, because the first thing, it ain't about me, it's about them. And I don't like the word those, but it is my dream that if we can just get people to understand, if it was not, it's not about being gay. Gay people go to church. I go to church. You go to church, everybody. So the faith community has a role, but we need to, if it had been taken away from the community that is hardest hit right now, we wouldn't be talking about all the stigma. If we could just reverse that and just focus on people. So it'll be equal to me and you. We ought to be in this together. It shouldn't be that I'm at a higher risk and you at a higher risk. We need to talk about this and get the word in the community. And until we can find a way to make that happen, because it's not about who we are, it's what we do. It can happen to anyone. And that's my spiel. I want it to be about everyone. And I'm your sister, I'm your brother, whatever I can be. I'm here to support, so here to help. And I just want this to go away. I want HIV to end.
I would just like to kind of there's one population I know that we didn't kind of mention on, and that's the youth population. I know that we don't have a lot of access to that particular community due to schools and those types of things. But I wanted to know that there's a particular population I know needs a lot more education, just kind of move forward. And me just being an individual that lived with HIV, I was one of those ones that, contracted HIV between the 13 and 24-year-olds. So if we did start having those particular conversations a little bit earlier, we can start becoming our own mentors, and not mentors, but advocates and those types of things, to make sure that we're spreading the correct messages and making sure that we're getting people on preventative medicines a little bit early. Or if you are in fact positive, making sure that you're continuously engaged in care as well. But I definitely want us to, not miss our youth in this particular conversation, because we know that 1 in 4 youth do account for new HIV infections as well. So definitely don't want us to miss our youth in this conversation as well.
Oh, I'm an advocate for youth because I have worked with our youth girls. I actually did an HIV prevention program called CLA. I did that for like 3 years. And it was very, very hard getting girls to participate, simply because I had to get parental consent. And getting parental consent was difficult because a lot of parents' mentality was that I was giving their kids the knowledge to go out to have sex. I was telling them, even though I'm giving them information about prevention, but I'm telling them about sex. So that's telling them to go out and have sex. That's the parents' mentality. So a lot of them wouldn't let their kids participate. So I never understood that. But if you're going into the high school, you're seeing all of these girls walking around pregnant. So they're having sex. You look at the statistics of girls, that age range, they're pregnant. So they're having sex. So how is it that I'm the one coming in, if I'm giving them education about, prevention, HIV, STDs, and how to properly use a condom, that I'm actually giving them the okay to go to have sex? I never understood that. So, it was really hard. That was one of the hardest programs I ever had, with getting consent to actually, have girls to participate. So I started only having programs 18 and older, where I did not have to get parental consent. So it's hard. It's hard when you haven't get parental.
Well,
and what they're teaching the kids in school under the abstinence plus. Don't get me started. Leave that alone.
Well, when I first started, I did all the schools, talked about everything. And so this abstinence plus came along later. But it was okay. I even had parents come up and say, were you the lady that went and talked to my daughter? I need for you to come and talk to us, because they didn't know. So things changed when this abstinence only came into the schools. And so we just have to confirm and just try to do it outside of the school setting as much as we possibly can, having community events, promoting wellness. We have a program called Girls to Pearls in the Belzoni area, where the young ladies come in and they have open discussions about certain things, and they learn. And statistics always paint the pretty picture to say the more that a young person, a youth, knows about STDs and HIV, they're less likely to engage in those activities that will put them at risk. So we just have to do a better job in trying to work on it. And it's hard, Dr. Palmer. This is really hard. And we just got to keep trying and doing the best that we can to make it better for everyone.
Okay, so at this time, I would like Sid to share his journey um, well, Sid has been in movies and in magazines and all the above. So I would like Sid to just come in and just give his story.
Thank you, Dr. Palmer. And I must say, this has been a journey. It's been a great journey for me as to where I'm at now. But it started in 2005 when my partner and I, my partner first had blood drawn at a blood drive at where he was working. At this time, we was living in Greenville, Texas. And they called him back to let him know that he needed to go get tested. And after he did, he tested positive. And of course, I had to go get tested. And I tested positive as well. So not knowing much about HIV at this time, because I wasn't educated about it, didn't want to get educated about it. I'm thinking I've been with this guy here for, at that time, I think it was about 5 years. And he's been my only partner, so I don't have to worry about it. We didn't seek help. We didn't seek medical help. We just continued to just live our life like nothing had happened. So we fast forward a year in 2006, June of 2006. I had moved to Memphis and my partner remained in Texas. And on June the 6th of 2006, I got a phone call stating that my partner had passed away. And I was very, very sick. So, I was losing weight. I began throwing up, becoming dehydrated. And I finally went to the hospital and the doctor told me that I had some type of fungus in my stomach as it related to AIDS. So by this time, the HIV had transitioned into AIDS. So I spent 13 days in that hospital. Didn't know whether I was going to live or die. Of course, mother was there. And one thing that I always remember is and tell people that God told me, I'm saying, my mother told me, God got you, you're going to be all right. So after getting out of the hospital, I moved back to this area I'm in now, Greenville, Mississippi, with my mother, and start seeking care. And as I began to get well, I decided that I wanted to do some advocacy work, because as I told my family, it wasn't man that saved me, it was God. And let me go back a little bit. I had a CD4 count of 7 and viral loads up in the 200,000. I really, the doctor thought I wasn't going to make it out of the hospital, but like I said, but God. And so once I got well enough to start back doing things for myself, like driving and all that, for at least a month or so after I moved back home, I couldn't do any of that. My mother had to take me everywhere. I got involved in some advocacy work through the clinic that I was going to. And as a couple of years went by, I educated myself on HIV, took some trips to Washington, D.C. for AIDS Watch. And I got a job in Jackson working at an organization. And that's actually where I met Dr. Palmer, working at this organization, and I was an outreach worker. And through that work, I met a lot of young men because most of our focus was on Black gay men. Met a lot of young men that sharing my story helped them. And after a while, I became the face of HIV in that area. As Shemeka stated earlier, that I did a spot in the Jackson newspaper, I forgot what the name of it is, on there as being a Black gay man living with HIV. I was a part of Pause magazine, as well as the New York Times. And we did in 2012, we did a film called Deep South, which was played all across the all across the state, all across the country, as well as I think over in uh, London. But one of the things that I was most concerned about is the fact that my home area wasn't getting the attention that Jackson was. And I realized Jackson was a big city in the metropolitan area, but there were people living in my home area, which is the Delta, the rural Mississippi, that they wasn't getting the attention as people in Jackson and what have you. So I worked for this organization for about 8 years, and I learned as much as I can in my advocacy work. I did a lot of traveling, speaking on that, and I worked with another organization, actually, organization that Ms. Davis worked at, and under Ms. Davis, I learned a lot of stuff too as well. But my thought was, I still need to help my people in the Delta. And it didn't seem as if funding was going that way. So I got that opportunity to move back here. And it's actually been great. That's why I say my journey now, we don't know what God has planned for us. We just basically try to live our life. So I had no idea. And I actually, when I was to come back here, I was like, God, that's not where I want to go. I want to go to Dallas. But I ended up coming back here. Things were set up in a way to where I could do the work and be able to get with the community, talk with the community, not just the LGBTQ community or just people living with HIV, other non-traditional HIV organizations, and teaching them and talking to them and collaborating with them on that. So now here I am. Our organization, as Community Health-PIER, is 1 year old. I worked 2 years under another organization, just getting all this set up, and we're doing the work. We're in the community. We've been blessed with some very good grants this year alone, to where we can sustain. And my message is basically this: don't give up. You know, I was told at one point, I asked for a raise on the job, and I was told at that point, you know, get a degree. At that point, I didn't have a degree, and I still don't have a degree. But God, I have what the word they're using now, lived experience. So I have a lot of lived experience with this, and people trust me. People trust the people that I have working for me now. That's my key thing. If you're going to work in the community, I need to know that these people in the community that we're serving trust you and know that you won't go out telling their business, nor will you go out trying to make them another statistic in your sexual box. I have a beautiful older woman that works for it, that's been living with HIV for 30-some years, who just have great communication with women and men in the community. So this journey that I've had over these last 16 years has been one that I never would have wrote down, because I didn't think that was the direction I was going. I didn't think I would be in this type of work. On June the 6th of this year, I actually was ordained as a minister. So I'm a licensed in ministry. And it's just been a great journey, Dr. Palmer. It's been amazing to me, you know, and I realized that it wasn't about me. I realized that the plan that God was laying out, that I had to do and listen to him, it wasn't about me, because coming back home to this area is really not what I wanted to do. You know, I'm still young. I'm 56. I have a little bit more partying in me, so I wanted to go somewhere else. It's in a big city. So, you know, so I'm grateful for this journey. Since I got out of the hospital in 2006, I have not been in the hospital as anything AIDS related. I am a diabetic too, so that's up and down, but I'm still healthy. You know, I have no problems. I walk through my house every day, and I just look and say, wow, you know, I'm somewhere, I'm here, you know, and I'm by myself right now, Dr. Palmer. You know, at one time, I had a house full of young men that was, I mean, I think it was like 10 or something that didn't have places to stay, but I helped provide them for a place to stay. And this was not through an organization. This was me doing on my own. And the sad stories that they were going through. So, and and that was all God too, you know, because trust me, but that's my journey and I'm happy. I thank God every day for it. I thank God for the people, the leaders he put in my life. You know, like I have to say Dr. June Gibson, like Miss Davis, that helped me to get where I am now. And you know, I'm going to be honest with you, Ms. Davis. You know, I don't see how you've been doing it all this year. Because the rest of it right now, I'm ready to pull my hair out and I don't even have it anymore. So I understand the life of executive director. So I commend you, Ms. Davis, for doing such a good job all these years. And thank you for believing in me when you hired me. And that's all I can say. It's been a wonderful journey.
And I can attest to the work that SAID has been doing all of these years because at the support group that SAID was over and just the trust in the community that people have for SAID. And like you said, he opened his home to people who just didn't have a place to go. That's the type of heart SAID has. So I just commend SAID and all of the work that he's doing and has done in the past, and just continue to do the work that you're doing. And when SAID first told me the story and showed me the picture, you know, I was like, wow, there was nobody but God, you know, that brought you back. Because if you would have saw the picture, you would have been like, oh my God, you know, it was just amazing that you actually was able to be nursed back to health. And so the journey has been amazing. And just, you know, just all that he does and help, you know, in the community and anyone that, you know, you can say Cedric Sturdevant, everybody in Jackson knows SAID. So, and in the Delta, you know, you say Cedric Sturdevant, everybody knows SAID. So thank you for all that you do. And thank you for being a panelist on this forum. And so we will have Dr. Johnson. Well, do we have any questions or anything else that any of the panelists have to say, would like to add?
No, I just want to say thank you, Miss Palmer, for having me. You know, we've been worked just for a couple times now, and I've definitely enjoyed you. I definitely want to share. We are talking about ending the HIV epidemic. That we do have a program at St. Jude for youth individuals under 17. For a new prevention program, a drug that we're looking at called CARE4ME. So if you want more information, please reach out to myself, as well as other programs that we have as well. And as well as go like, share, subscribe to Headliners Memphis, where we will be having our Trans Girls Rock Awards coming up very soon. But that's all I had.
And always a shameless plug. You can follow the initiative that we are running for ending the HIV epidemic initiative in Shelby County at endhiv901.org. And we also have a funding announcement that is out. So if you are looking for funding in Shelby County, if you are an organization that provides HIV services, if you are not, please refer to endhiv901.org on how you can apply for the funding. And we are looking for everybody to just do the good work as going along and do the good Lord's work. Follow us along and follow me on TikTok.
Yes, and Dr. Palmer, thank you so much. And it's an honor to be on this panel with such distinguished individuals. And I know Cedric really well, but I would like to get contact information because that's how I am. The other two persons, and I know Dr. Palmer will, but I just want to say that this has been a battle. It's been a long one. And the only reason I'm in it is because there's so much more that needs to be done. And together, not separated, but collaborating together, we can work this thing out. This is about our community, our community, and we're all in this together. And I just want to say we need to work on ending this epidemic, although it's a pandemic. And if you ever see that the regular bus of ours rolling down the road, we do some pop-up, stop by, stop by, see us, just say hello. I want you to know they are a dynamic team, the CARE4ME Services team and the Belzoni team. They are really wonderful. And if you see them, pat them on the back, because last month they tested 174 people, and that was unheard of in COVID time. So they roll every day. They were in Mississippi Valley State today. So we just have to collaborate, and whatever we can do together, we're going to do it. And thank you so much for your testimony, Cedric. And thanks to the Hooks, I may get the name wrong, but thanks to you all for accommodating Dr. Shemeka Hamlin.
Thank you. So now we will have Dr. Johnson to come in with closing remarks.
Oh, let me just say thank you for this wonderful panel, this wonderful discussion on this important topic. And I really want to thank you for the work that you have already done, the work you continue to do, and the work you will continue to do to help us all fight this and to be more mindful and more informed about HIV in our community. So thank you again for all of your time today. Thank you for your testimonies, and thank you for your brilliance on this panel. I want to shout out again Dr. Shemeka Palmer for putting this panel together. Let me shout out Brother Nate Ball and Megan Cullen for being a part of this Facebook Live event. In her absence tonight, our Executive Director, Daphne McFerrin, we thank you for your leadership and guidance and brilliance on helping us do what we feel called and need to do. And again, the Hooks Institute, go to our webpage, like our Facebook page, sign up for our newsletters and our newsletter so you can keep abreast on what's happening. Our mission of teaching and studying and promoting civil rights and social change allows the Hooks Institute to address contemporary racial, social, economic, and other disparities through community engagement and faculty scholarship. It is indeed an honor and a privilege to be the scholar in residence of this fine institute. I am Dr. Andre Johnson, Associate Professor of Rhetoric and Media Studies in the Department of Communication and Film, and the scholar in residence right here at the Benjamin L. Hooks Institute for Social Change. I thank you for joining us. Please click that share button, like us on Facebook, follow us on Twitter, go over to YouTube and follow us there as well. This will be up in probably the next couple of days, so you can watch this over again and share it with others. Thank you for joining us. And until next time, we see you. Bye now.
Bye-bye.